Welcome to Science, Health and Healing Encyclopedia of Children's Health Core and Ali Academy. I'm Dr. Majid Ali. The subject of this video is Paradoxical Insulin Response, Part 1. In insulin toxicity, when you institute an effective insulin reduction program, such as I described in a video entitled Dr. Ali's Insulin Reduction Program, the insulin levels come down because you increase the efficiency of insulin and you avoid all the negative effects of insulin toxicity. But initially, you can have a response which is paradoxical. The individual feels better, you lose weight, and you think you're moving in the right direction, you're more energetic, you feel lighter, you don't have problems of sugar roller coasters, you don't go into sugar craving followed by problems of low blood sugar hypoglycemia. And yet, when the insulin test is done, the blood values actually are higher than when you started the insulin reduction program. So unless the physician is aware of this response, it will create stress both for the patient and for the physician. In part 2 of this video, Paradoxical Insulin Response, I describe a case and give you the numbers of insulin profiles done before and 8 weeks after doing the insulin reduction program, where this is exactly what happened. The patient was feeling much better. She lost 6 pounds in 8 weeks. We don't really like very rapid weight loss, so I was comfortable with it. More importantly, her symptoms of gastritis and GERD cleared up. She felt lighter. But it caused a lot of stress on her when she compared the insulin profile values done before starting Dr. Ali's insulin reduction program and after 8 weeks of doing the program. So I thought, in fact, this was the first case that I was initially very surprised. You always think about if the laboratory is making a mistake. When you see something for the first time which is very atypical, which is very unexpected, and which on the surface is illogical, you think about the possibility of a laboratory error. But I had never seen this case in such clear way. And so I thought that I needed to make a new term. And I decided on paradoxical insulin response. Please look at all 3 segments in this series on paradoxical insulin response. You really need to understand that. There is a reason why I have close to 70 videos on this encyclopedia about insulin toxicities, how are they created, what the clinical consequences are, how to reduce insulin, make it efficient, and the relationship of insulin toxicity to prediabetes and eventually diabetes. So the subject is very important. I ask you to forward this YouTube segment to your contacts so they can also become aware of this pattern. It sheds additional light to the insulin dynamics. Insulin is the minister of metabolism and energy to oxygen, king of human biology. We need to understand this. Our vision at Children's Health Core is to provide authentic information free of cost, free of corporate deceptions, and free of ideological distortions. Thank you for joining me. Thank you so much.